I did choose it at an early age, and I was in internal medicine, and I have always been just fascinated by the heart as sort of the center of it all. And I have really had a passion for it throughout my life. And I would say one of the reasons that I like it so much, and I would suggest it for young people, is that there's so much that can be done in the field of cardiology. There's so much that has been done over the last 75 years in this field, and we've had so many advances, from stents, to basically, fix heart attacks and have patients going home in 1 to 2 days, to these valve therapies that can be done percutaneously now. We are putting in more aortic valves percutaneously than surgeons who are replacing aortic valves. So that's actually being done more by cardiologists than surgeons. And then, when you think about some current events on the playing field, just the whole development of defibrillators in the field of electrophysiology to control people with serious heart rhythms and save lives that way. So there's so much real diversity in the science and in so many ways that we have had advances in this field, and there's always something new and exciting. So I would highly recommend it for young people to consider medicine and to consider the cardiovascular track, because I think, if there's something that doesn't interest you, there's probably something else that you can find that you like and can develop a passion for. Now, I would like to feature that we have a couple of programs that are going on from the ACC. I'm not sure if you were at the opening ceremony, but over there on the right side in the main tent of the audience, we had 2 groups. We had both our Young Scholars group, which was over 150 young people who are in high school or college who had elected to take time out and come to the meeting and just, walk around and see the science, and also they're being toured around as well to make sense of things. We also had them at our Heart House this past fall for a 2-day event where they learned CPR and AED management and so forth. Again, really totally for their benefit to interest them in medicine and cardiology. The other is we also have our internal medicine program for underrepresented groups, and we have had really close to 100 folks that have been enrolled in that as well. People from underrepresented minorities and so forth that we are trying to interest in cardiology as well, because we also know that patients respond to patients and doctors that they're comfortable with, and so we're very pleased at the growth of these programs, which I might also mention started 4 years ago with this convention here in New Orleans, the ACC 2019.